Good afternoon, everybody. Today's our topic of discussion is edema due to heart failure. As everybody is aware that heart is one of the best pump made by nature. So it pumps around 2000 or maybe more than gallons per liter per day. So can you imagine how efficient the pump is? So whenever this pump works normally, everything is fine. But if it is not pumping properly or when it is there is a heart failure, that means pump is failing, then the problem starts. And what are the ways to diagnose or suspect there is a heart failure? So first, heart failure means what? Is it really heart totally stop pumping the blood? No, it is not. But it should be the way it should be pumped normally. It doesn't. So it may be depending upon the pumping of the heart, the affect the how badly it is affected. Depending upon that, heart failure can be classified. It may be mild, moderate, severe. There's different types of classification, types of classification on the basis of symptomatology also. But when do we suspect heart failure? First, whenever there is a edema. So usually first start edema in the legs. So edema means what? Is the swelling of the legs. So it may be unilateral, bilateral, but most of the time it's bilateral. So depending upon the side of the heart, it may be right side heart or the left side heart. So depending upon the side of the heart, which side of the heart is involved, symptomatology can happen. So whenever there is a left side of the heart fails, there is a pumping of the blood supplied from the left side of the heart that means to the whole body. It is affected. So we get symptoms accordingly. So there may be and sometimes there may be back pressure changes. You may get a pulmonary edema also. That means there is a water accumulation in the lungs. And whenever there is a right side of the heart is failing or failed, there is all the venous blood come to the right side of the heart. So that is getting affected. That means that cannot be come into the right side of the heart. So that fluid gets accumulated in the periphery. So again, you may get a leg edema. There may be swelling of the abdomen. There may be swelling of the stomach. There may be, or sometimes there may be a generalized anasarca, or there may be swelling of the whole body. So depending upon the side of the heart, right side or the left side, we may get a symptoms, and there may be a congestive cardiac failure. That means both the sides of the heart are failed. So you may get whole generalized anasarca, or you may be pulmonary edema. There may be a swelling of the legs. There may be swelling of. So the symptomatology may be same once there is a severity of the heart failure or increased severity of the heart failure. So when do we suspect? First, there is a heart failure. Patient or maybe any person start complaining of breathlessness on minimal walking or maybe increased walking. If you see starts increase walking basically. So there may be a breathing difficulty. There may be a swelling of the legs. That time we should always suspect there may be a heart failure. So depending upon the symptomatology, there is a classification of the breathlessness. It is called as NYHA classification. Depending upon the classification, there are class 1, 2, 3 and 4. So class 3 and 4, that means is on minimal exertion we may get a breathlessness, and class 4 is dyspnea at rest, that is class 4. So whenever we diagnose there is a heart failure, where patient has to undergo or doctor has to advise him go to do certain restrictions once we are suspected that, and to confirm that we have to advise some tests. So the tests are like ECG, X-ray, 2D echo. These are the basic tests along with the all routine blood tests like CBC, urea, creatinine, electrolyte, all those tests we have to do. And once it is confirmed diagnosis, according to that we have to do management. So what kind of management we should do when there is a heart failure or when we suspect heart failure when patients even first come with the edema. So first is always a restriction of the fluid. So restriction of the fluid should be at least 1 to 1.2 liters standard restriction. Usually all medical doctors advise. Along with that, we have to stop or we have to restrict the salt intake. So salt intake should be just not more than 1 or 2 grams. So the salt is a major culprit for the retention of the water in the body. So we have to restrict the salt. Usually our salt content in the normal healthy diet should be around 6 to 7 grams per day. But whenever we are suspecting it's a heart failure, we should restrict it to around 2 to 3 grams, not more than that. Because salt is a major culprit for the retention of the fluid. So whenever retention of the fluid, edema is suspected because of the heart failure, we have to restrict these two factors which are daily in and out of the body. We have to restrict so that it is under control just with the diet and a salt restriction. Once it is confirmed it's a heart failure, then we have to start the medical management accordingly. So everybody must be aware of furosemide or the Lasix is a diuretic should be given in this. Then newer diuretics also should be given. And along with this, we must suspect what are the precipitating factors for this heart failure. So those factors should be avoided, like stress management should be done. There should not be unnecessary exertion. In heart failure patients, even though we have to avoid unnecessary exertion, but patient should not be completely bedridden. He should do some exercise like walking till he gets used to it or till he can accept it. So once heart failure is diagnosed, we have to take care of all these things as much as possible so that patient's hospitalization chances will come down. So salt restriction, fluid restriction, regular medications, and a regular follow-up to the doctor. So now these are the broad line I can give you on this talk. But what is the take-home message? When we suspect the heart failure, so whenever there is a unknown edema, bilateral edema, when there is a generalized anaphylactic or there is a swelling of the body, whole swelling of the body, if patient is sudden gain in a weight, loss of appetite, and patient is feeling puffed up, difficult to wear the sandals or chappals or shoes because of the swelling. So this time we have to always suspect, along with the breathlessness, we have to suspect that patient may be having an edema because of the heart failure. So this is the time to rush to a doctor and take the urgent treatment. Thank you very much.